Hello, my name is Red Taylor. I'm a firefighter with Rincon Valley Fire District. RBFD has 2 fire stations covering approximately 350 square miles with 56 full-time employees. The goal of the community risk reduction plan is to reduce the number of fall injuries in the 65 and older communities, or at least reduce the severity of fall injuries, as they will never be eliminated. With the alarming number of fall injuries and the higher projection of older adults in the community, more fall injuries are to be anticipated. According to the Centers for Disease Control and Prevention, 1 in 4 65 and older adults reports falling, leading to a low quality of life, high medical and rehabilitation costs, loss of independence, or even death. RBFD's incident volume has a significant focus in adult living communities. Within these communities, many incidents are of fall injuries and public assistance, which includes lift assist and smoke detector checks. With the proper education and assistance spreading to the 65 and older community, healthcare providers, caretakers, and family members, fall injuries can be reduced and help further generations. Typically in communities, there is a precedence on education for children and very little on for older adults. The lack of education is assessing and preventing falls in residents' homes can be reduced. The CRR Fall Injury Prevention Program would help educate them on avoiding falls and what resources are available. Due to the majority of fall injuries being in the adult living communities, such as Hacienda del Webb and Academy Village, partnerships with senior citizen groups, Northwest Medical Center, Vale Christ Community, and RBFD will lead the program to implement the CRR program for the district residents. Because RBFD responds to many fall injuries and public assistance calls, RBFD emergency units have the perfect opportunity to provide education and information to residents. However, many district employees do not know how to educate the residents with appropriate information. This fall prevention program assists with home inspections that include removing trip hazards like throw rugs and instead utilizing non-slip mats and handrails. Rincon Valley Fire District is partnering with various shared interest parties such as the hospitals and senior citizen groups. These groups each have their own way of contributing to their cause. They may be great avenues to spread information about fall prevention. They could assist with gathering data on fall injuries, or they might be able to supply the CRR plan with resources needed to make older adults safer at home. These partnerships will use strategies and tactics to mitigate the problems and have input for information. One of the most important advantages of these partnerships is to use them to spread education and information. This program directly affects RBFD as well. Reducing the number of fall injuries and lift assistance incidents in the district can relieve the strain on RBFD. Fewer incidents means fewer units unavailable for other priority emergencies and more available for life-threatening emergencies. RBFD's community is dramatically growing, and so is the call volume. With a limited number of ambulances and resources, efforts towards CRR plan should be maximized. Healthcare costs following a fall injury can be quite substantial. A CRR plan can also help people from becoming financially liable for owing money that they were previously counting on. Therefore, another benefit of the fall prevention program is reducing the financial strain that comes with healthcare costs, rehabilitation costs, and potentially many more costs due to fall. For this community risk reduction plan to succeed, a committee would need to be formed that would include district residents, partnership members, and district employees. The committee members would use research strategy and tactics to create data for further progress in the program. Partnerships would be used to spread education through numerous avenues and support identifying the risk areas. The CDC uses community-based fall prevention programs to implement an effective fall prevention strategy. Additional resources include the National Council on Aging and the PEMA Council on Aging. These are more unique to the Southern Arizona communities. A unique aspect of the PCOA is that it celebrates Fall Prevention Awareness Week to bring education and information to the public. This could be greatly beneficial if adopted by the RBFD community. According to Flanagan, when falls occur, not only does a fall injury affect physical health, but it also affects the mental and financial health of the individual. A fall injury can also affect the individual independence. Therefore, establishing an exercise program and teaching individuals how to live independently is essential in reducing the number of fall injuries and the severity of when they happen. It is important to utilize local, state, and federal resources to spread education. RVFD and the local union can be used to do home inspections and personally assist older adults with further help. Lastly, the program will need a constant revision to ensure it is up to date and effectively making a difference. Thank you and have a good day.